On this episode of 26 Minutes with Dr. Warren Siegel, I'm joined by Dr. Cliff Glatzer as we delve into the vital topic of blood pressure and how we can control it. Together, we'll break down what everyone should know about managing and understanding this key aspect of our health. Stay tuned for practical tips and insights that can make all the difference in your well-being. Dr. Glatzer, thank you so much for coming on the show.
Well, thank you for inviting me.
So tell us a little bit about yourself. Where are you from? What do you do?
Okay, I was born and bred born in Brooklyn. I grew up in Long Island. I've been a physician for 46 years. I actually trained here when it was Coney Island Hospital. Then after that, I went to private practice for 10 years. And now I've been back here in primary care for 36 years.
So when you say primary care, can you explain what does that mean?
Yeah, we used to call ourselves internists. Now they've changed our name to primary care physician. Basically, we take care of all aspects of adult health and medicine.
So when you say adult, what's the
18
earliest?
and above.
So 18 and above.
18 is the earliest, yes.
So if you're an adult, I come to see you and you manage all of my health?
All of the health that I'm capable of managing. If we need other help from other specialists, we refer to other specialists. We're the gatekeeper in medicine these days. So if you come to me and you have some digestive problems or some endocrine problems or other things and we can't handle it, we refer you on to the specialist.
So when I think about going to a primary care internist, is that like years ago we used to talk about a general practitioner?
Yes. It's probably, yeah, it's most likely the same thing. The general practitioners back in the day, however, treated all age groups, and we're only treating 18 and above.
So you're an internist specifically trained to take care of adults starting at 18 and going up. Is there an end?
On the age, you mean,
yeah.
or the other end?
Yeah.
No. I mean, my oldest patient right now is 98 years old.
Wow.
We do, we do have specialists who do geriatrics. But my patients who have been with me for 36 years are staying with me. So they age while I age, you know. So.
That's wonderful. So I can develop a relationship with you from adulthood, and you're going to help me take care of my health.
Yeah, in fact, now I'm taking care of children of my patients. I mean, not children. I mean, they're children, but they're adults now.
Right,
you know, because the age is, you know, I have a lot of advanced age patients.
So I hear a lot lately about high blood pressure. Mm-hmm. We hear about stress. We hear about salt. Tell us a little bit, what is high blood pressure? And most importantly, how do we keep from developing hypertension?
No problem. All right, we can talk about that. Let me just define what the definition is of normal blood pressure, which may surprise a lot of people out there. Normal blood pressure is a systolic blood pressure, which is the top number when your doctor takes it, less than 120, and a diastolic, which is the bottom, less than 80. That's normal. I don't know how many people are going to get a little upset with that, but that's what normal is called. High blood pressure is numbers above that. We call elevated blood pressure a little bit above that. We start calling it high blood pressure, and what we refer to as stage 1, is a blood pressure reading between 130 to 139 systolic top number, over 80 bottom number is stage 1 hypertension. That's according to the American Heart Association. There are a lot of other societies that have a different thing. The NIH and a lot of the European societies only have it as 140 over 90. That and above is high blood pressure.
So basically, when I go to my internist and they put that cuff on me and they pump it up and they come up with these numbers, what are they measuring? What is that?
All right. Blood pressure, I mean, it's a mathematical formula. It's your heart rate times the resistance in your arteries, which we really can't measure, but we can know. But you'll know that people will know also that if your heart's beating real fast, you're going to get a higher blood pressure. All right, that's just part of the equation. But it's basically an inelasticity of the arteries. They don't expand as well. So it's like any pump that you have. The heart's pumping out, or even a water pump pumping out your sewer. If the hose is too narrow, it's going to build up pressure. And that's where the pressure elevates from.
That's an interesting way of thinking about it. So the heart is the pump,
Right.
and blood pressure is just measuring how much pressure is being pushed through the arteries and the rest of the body.
Right.
That's an interesting way of thinking about it. So why is it important to keep blood pressure down?
All right. Blood pressure, they call it the silent killer. The reason that is that there are really no symptoms until you have problems. And then it's a little late to start doing things about it. The only symptom that people will say, oh, if I get a headache, my pressure must be up. But the only real headache that's caused by high blood pressure is that morning headache that feels like a tight band around your whole head. That's probably indicated maybe that your pressure's high. Your other headaches probably have nothing to do with your blood pressure. But the risk factors for blood pressure are the complications of high blood pressure over time. And that's an enlarged heart, which we call left ventricular hypertrophy. And think about it again as the pump. The pump's trying to work harder, so it's getting bigger to try to do the same job. Bigger on a regular pump is okay. Bigger on your heart is no good at all. Okay, that can lead to heart failure, which means the pump is failing. So like anything else pump that fails, you get backup. You get backup of water into your lungs. You don't breathe right. You can get swelling in your legs because the pump's not working right. And you can get difficulty walking and doing your regular daily stuff. So that's one of the things. The other one of the complications of high blood pressure is stroke, which everybody knows what stroke is these days. You can also get bleeds into the brain because of the increased pressure. The other thing that's affected by it is kidneys. Kidneys can be really destroyed by prolonged high blood pressure that's not well controlled. And the other thing is heart, not the pump part, but you can have a higher risk for having heart attacks if your blood pressure remains elevated. So those are the real reasons why you want to control your blood pressure.
Wow, so those are all the complications of walking around with high blood pressure. But I think you said this is also known as the silent killer.
Right.
So that means that I might have absolutely no signs, no symptoms, and still have high blood pressure?
No symptoms until you get one of the complications. And once you have one of the complications, then you go in for something, oh, doc, I'm having chest pain, and he finds out your blood pressure's high.
Wow.
So what the recommendation is for people, and we'll come back to it if you want, people over the age of 18 with no risk factors, which we can talk about, should have their blood pressure checked once a year, really. If you have risk factors, then you should be checked twice a year.
So what are the risk factors? When I think of high blood pressure, the cause of high blood pressure, I start thinking, okay, I didn't fight with my kids. Okay, I have kids. That puts me at high risk. What?
Well, not really.
I've got a mean boss. I mean, what
that
puts
you
me
at high risk for other things, but not for high blood pressure. The risk factors for high blood pressure is a high salt diet, obesity, too much alcohol use, and you'd be surprised. That means for women, one alcoholic drink a day. For a male, 2 alcoholic drinks a day. Insufficient sleep. You should have at least 7 hours of sleep. It used to be 8, but they're saying 7's okay.
I'm sure it's smoking.
No,
right?
Smoking is actually not there.
Really?
Yeah, it's surprising. Smoking will elevate your blood pressure momentarily, but it does a lot of other bad things that you don't need. Inactivity, advanced age. And the other thing is, in our black population, they're at a much higher risk. They're at a 30% higher risk of developing hypertension, and their hypertension is more resistant. It means it's harder to treat. Family history counts also. If you have 1 or 2 parents with high blood pressure, you have a 20% increase of having high blood pressure. They're not sure about the genetics of it, but they just see it in families that way.
Wow, so let me see if I get this. If my parents had high blood pressure,
one or the other,
also known as hypertension, right?
Right.
That's the same term.
Yes.
Then I should get my blood pressure checked at least twice a year?
Yes.
If I am sedentary, I'm obese, I drink alcohol more than 2 drinks a day for male and 1 per day for females.
Yes, that's correct.
I should have my blood pressure checked at least twice a year. And if I'm not sleeping at least 7 hours a night, I should get my blood pressure. I don't know too many people who shouldn't have their blood pressure checked
absolutely.
twice a year.
I think everybody should have their blood pressure checked.
So can you talk a little bit about how to take your blood pressure? What's the best way to take your blood pressure?
Absolutely. You should be take no stimulants at least 30 minutes before. Stimulants being the cigarettes that you talked about, caffeine, caffeinated beverages, alcohol. No exercise for 30 minutes before, okay? Then you should be resting for 5 minutes, seated, with your back supported, your arms supported, your legs uncrossed, feet flat on the floor. And then you can check your blood pressure. The easiest thing for most people nowadays are the electronic BP cuffs. What I advise, though, is only get the ones that go on your upper arm, not your wrist or your finger. They're not that accurate. Coming back to, you asked me about the machines outside, like in the drugstores, and I don't advise it because I don't think you can do everything we just mentioned at the drugstore. You've probably been shopping, you're walking around with packages, you're not going to sit there for 5 minutes, like this, and wait. So I don't rely on them at all. I tell my patients, please don't do it.
Yeah.
Because what happens is, is that the patient does it, runs into my office. My blood pressure is 190. Yeah. I said, no, it's not. It's 120. So,
but at the same time, I'm not going to go out and spend money on a blood pressure machine if my blood pressure is normal.
Right.
And if it's abnormal, if I only have to do it twice a year, I'm probably not going to spend the money.
Not if your blood pressure is abnormal. That you have to do more than twice a year. That's
got it.
That's just seeing if you have it.
So if I have a risk factor, I need my blood pressure checked at least twice a year.
Yes.
But if my blood pressure is elevated, then we're going to have to do it more often.
That's a whole other ballgame.
Okay.
What we recommend, if you have high blood pressure, or if you're borderline high blood pressure, according to whatever you're doing at home or what your doctor finds, we recommend doing morning and evening blood pressures for 1 week every month. And write the numbers down, bring them to your physician, because we can look at the mean blood pressures then. Not the average, but the mean blood pressures, and see if you need medication or if things are working or not working. People are more than welcome to check it daily. I think it's a little tiring to do that. People also have to know that blood pressure doesn't stay constant. It moves up and down. If your kids are giving you a hard time, your blood pressure is going to go up. As long as it doesn't stay up, that's fine. That's just normal. If you run from here down the block and take your blood pressure is going to be up. But that's normal. But if it stays up, that's where the problem is.
I see. So the fact that my blood pressure goes up during the day when I'm at work and my boss is yelling at me and people are giving me a hard time and I'm on the Belt Parkway and people are honking to get out of their way, that's okay. It's the blood pressure that's constantly above where it should be.
Exactly.
That's where we have to worry about.
That's what you have to worry about. See, the best way to do blood pressure, is what we call automated blood pressure reading at home. It's a machine that you wear like you do for a cardiogram, they do for Holter monitors. They have that for blood pressure. What's good about that, it gives you even your nighttime blood pressures when you're asleep. Because there is a certain population that their blood pressures rise during the night, and we're not aware of it. We're aware of it when we start seeing some complications of blood pressure and say, oh, maybe that's what's happening, but it does occur. And there's famous white coat hypertension. You go into your doctor's office, your blood pressure is 165/90. You brought in your things for home, they're 120/30. Your home one's the right one. The white coat hypertension is caused by the stress of being in the office.
So it's my doctor's fault.
Yes,
it's not
absolutely.
my blood pressure.
Absolutely. But I don't wear white coats, so I can't get blamed.
So that's okay.
Yeah.
So if my blood pressure is, we'll talk about prevention in a second, but if my blood pressure is high, how can I bring it down?
Okay. You have to work on your risk factors, right? So if you're obese, we want you to lose weight, okay? If you have a high salt diet, and the average salt diet in the United States is 3,600 milligrams a day. You want, for blood pressure, to prevent blood pressure and to treat. Both these things work. When you're working on you're doing both. You're treating and taking away your risk factor, okay? We should be down to 1,500 milligrams a day. Now, if you go out and have a Big Mac and a medium fries, you've hit your limit of 1,500 milligrams, basically. And what the problem is too, it's not, people say, well, I can't cook with salt. You can cook with salt, moderate. Because that's not where you're getting your salt from. You're getting your salt from processed foods, the deli foods. You're getting it from fast food, frozen foods, not frozen meals. If you ever look at it, I'll talk about packaging after. Frozen meals, you know, you go out and you buy a Salisbury steak and mashed potatoes. That's way back in the day, but you know, canned food. Every canned food has salt in it. If it says low sodium, it's still got too much sodium probably, because they use it as a preservative. So that's where the problem is. The problem is not so much the salt shaker, it's all these other things.
So when you're looking at the label, it's sodium and salt are synonymous. That's
Right,
the same
correct.
thing. So looking at the label, you're saying even if it's low sodium, still
It
has
may
too
be
much
too
salt.
high. You can look. It may still be. It'll be less, but it's, you know, depending on how much you can eat. Look at canned soups, for instance. Okay, there's a lot of low sodium canned soups out there. If you look at it, yeah, they're lower, but they're still, you know, if you're going to have, you know, it depends how much you're going to have. When you're reading labels too, you have to be careful, because if you look at the label, it'll say sodium 250 milligrams. Oh, that's great. That's per serving. There may be 8 servings in that box.
Right.
And that's what people don't look at. Oh, 250, that's great, I can have this, the whole box. No, you can't. And of course, chips and things like that. There are a lot of no salt options out there, okay? The other thing that helps is increasing the potassium in your diet, unless you have medical reasons not to, okay? Kidney disease, things like that. And that's fruits and vegetables. The next thing is decrease your alcohol intake, exercise. They say about 30 minutes a day. It doesn't have to be a lot of big, you can be walking, okay? I tell my patients though, listen, the walking you do in work or going from home is not exercise. That's your normal. Go out and walk. Take a walk, you know? And I tell people to start walking time. Don't go out and try to walk a mile. Go out, walk from here to your end of your block, or walk for 5 minutes. The next couple of days, do that, then walk for 6 minutes, then walk for 8, you know, just increase until you're walking for 30 minutes. It's the best exercise in the world because you can do it your whole life, you know, if nothing bad really happens to you. So that's really important. The diet is what we call the DASH diet. I got to remember with this, it's diet approach to stopping hypertension. Cool little acronym. What that basically is, increasing fruits and vegetables in your diet, using whole grains instead of plain white bread and things like that, increasing your poultry and fish intake, decreasing red meats and sweets, and using low-fat dairy products. You know, because that's how you take care of it initially.
So that's what you can do to bring down your blood pressure.
You can treat blood pressure and try to prevent your blood pressure the same way.
If it's already, and it's the same thing if I want to prevent
because
hypertension.
Because if you look at the risk factors compared to it's called lifestyle modification. That's the first treatment, right? If you look at lifestyle modification, it's attacking the risk factors. So it's logical.
That actually makes a lot of sense. What happens when blood pressure's still up? I mean, what if you go to the doctor, they say your blood pressure is still high, got to bring it down. What do you do? What's the first
All right, well, if lifestyle
thing?
modifications,
Hasn't worked.
My patients, if lifestyle, then it's medication. There's no getting around it. That's if you're being honest about your lifestyle modification, you know? Some patients will do it. I can just give you a little anecdote. My dad was a doctor, okay? And he treated a lot of diabetic patients. And they come in and tell him what they're eating and everything. And he says, you know what? If I put you in a hotel room and feed you what you're telling me you're eating, you'll lose weight, your blood pressure will go down, your sugar will get better. Because patients tend to, lie. They want to appear like they're doing the right thing. So medication is the next step. There are 4 classes of medications we use presently. One is diuretics, hydrochlorothiazide, hygrotin, those kinds of things. The next one is what we call a calcium channel blocker. People may know it as amlodipine or Norvasc. And then we use what we call ARBs and ACEs. Oh, we got these great names. The ARBs are losartan, known as Cozarb to people who may be on it. And the ACEs are lisinopril, monopril. Anything that ends in pril is ACE.
So, I don't expect you to teach us all how to be doctors, but how do you decide this patient needs that medication, that patient needs this medication, number one? And the second is, if I start medication, does that mean I have to be on this for the rest of my life?
The way I judge is because I've been doing it for 36 years. I mean, that's the simple answer. Okay, there are certain populations that you should use, like in the black population, the calcium channel blockers are probably better. But everybody ends up using it all. Okay, back in the day, people were talking about Lopressor, which we use more now for heart and everything, was the #1 drug for high blood pressure when it came out back, I think, in the 80s or maybe the late 70s. Now you don't use it in high blood pressure. So, things change over time. Will something new come out? Probably. But right now, those are the 4 basics. I'm sorry, I missed the other part.
And if I start medication, does that mean I've got to be on it forever? That's a fear that so many of us have.
Yes and no. If you can really get into it, let's say you're obese. Let's say your BMI is 45. That's morbid obesity. 30 BMI is regular obesity. If you can bring your body weight down closer to where ideal body weight, you may be able to come off medications. Patients who have had bariatric surgery, weight loss surgery, I've had 4 or 5 patients, they're off the diabetic medicine and their high blood pressure medicines. So it just shows you what obesity really does. Other patients, they're going to go out and eat McDonald's and eat chips and eat fries and whatever else, and they're never going to come off medication. You can explain it to them till you're blue in the face. But plus it's hard in certain socioeconomic groups for them to eat healthy diets, so yeah, some people can come off. The majority, probably not, unless we all go for bariatric surgery and lose weight,
Well,
or get on Ozempic.
When I sit at home, I see all these commercials for these miracle, what I look at as miracle, and I know some of them are real, and the results are real, and patients are doing very, very well. But I get worried about this idea of just take a pill, it'll solve all your problems.
Yes, the problem is, let's take Ozempic or Mounjaro, what everybody's talking about, the injectable. Yes, it works. I mean, it wasn't meant for that, but it does work. Well, Mounjaro is, but the problem is when you stop it, because you haven't learned how to eat. So that's why I have my diabetics on it, because I want them to lose weight, okay? And hopefully with the nutritionists and weight management, they'll learn how to eat. But it's like any fad diet. You can do it, you can lose 10 pounds in a week, but what you've lost is water weight. And then you're going to put it right back on. It was all of them from Atkins forward. The only really decent one out there that's not medical is probably Weight Watchers, because they're just regular food and teaching you how to eat. Because if you take all this stuff and don't learn how to eat, as soon as you're off of it, you're bouncing right back up. The problem with the human body is that we have an appetite center that was set at birth, and you're fighting against it, because they want you to be X weight, and you have to fight against it. Once you stop fighting, your body's going to just take you right back up there. You're going to start eating more, you're going to go back to old habits maybe, but it's going to try to bring you back up, and you've got to fight that. So it's tough.
So this is about preventing diseases. We want to prevent people from getting high blood pressure. You've talked a little bit about what we can do when we have high blood pressure, how we can modify some of the risk factors, and how to get treated. Is this just inevitable as we get older? You said some of the arteries get stiffer.
No, it's not inevitable. I have old patients, I'm one of those, who don't have high blood pressure. There's got to be other components to it that, we're not aware of. There must be a genetic component we're not sure about. But no, you don't have to get high blood pressure. Listen, I have patients who weigh 360 pounds, who eat whatever they want to eat, who have normal sugars, normal blood pressure, no heart disease. So there's got to be something else going on.
They're lucky.
Yes.
They're lucky.
Or they have good genetics.
I
have patients who I have a patient now, have the son of a patient now. The father was a diabetic, hypertensive, heart disease. He went blind from diabetes. He had renal failure. He got an amputation. His son has all the same medical problems, but his son is taking care of himself, and all his vitals and everything else, his sugar, everything is in normal range. So he's not getting the complications of the diseases like his dad did. He learned a hard way to do it. I said that we should set up, you know how they have Scared Straight for kids, juvenile, put them in the jail for a day or two? We should have Scared Straight for hypertensives and diabetics, etc. Bring them to places where they see the damage done by it. Because otherwise it's theoretical. And if you're feeling well, and you have hypertension, don't know about it, you may not go to a doctor.
Well, the silent killer can kill. Well, I really want to thank you. These are wonderful tips because, once again, what we're talking about is being healthy, preventing a disease. It's not inevitable, and I really thank you for
You're
what
very
you've shared
welcome.
today.
And I've always said we're the people who should put ourselves out of business.
That's
by
true.
making everybody healthy.
And that brings us to the end of our program today. We thank you for tuning in and learning alongside of us. For more information about our show, please call 718-510-2103 or visit us at www.zormed.com. Stay updated and engaged with South Brooklyn Health by visiting us online at www.New York City Health and Hospitals South Brooklyn Health. Until next time, thank you, stay healthy. This broadcast was brought to you by Brick Media in partnership with South Brooklyn Health. Goodbye.